Hello and welcome to the Dr. Ayaz Safi Podcast. In today's episode, I'm delighted to have Dr. Regina Keith, a senior lecturer and course leader for MSc in Global Public Health Nutrition at the University of Westminster. Regina has over 40 years of experience in health sector development, with 35 years of experience in international development in health, nutrition, HIV, and social development, and has worked in 56 different countries from household to global interventions. Regina also has 23 years of experience as a senior health policy, leading global policy development and change. Regina also has experience of public health services like the NHS to global health advisor with NGOs like Save the Children and World Vision. In this episode, Regina and I discuss that health and food should not be used as a weapon of war. Regina, thank you for joining me.
It's lovely to be here.
It's a great introduction, Regina, with tons of experience.
It's long.
It is,
I'm showing aware of it.
Yeah, how you manage doing all this. It's amazing.
I know, the little nurse from Cork, or not so little anymore, but yeah, I guess I'm privileged. I've had a really amazing career. And yeah, it's funny, again, if you'd asked us growing up in inner city New York, in a large family, food insecure family at times, and then, being a nurse from Cork in Ireland, going off and being at the World Health Assembly, or working in Afghanistan, your own home country, or other countries in the world, it's not a privilege that many get. It's certainly not the path that I thought I was following, but there you go.
But hey, here you are, and I think you touched upon so many lives positively and made that difference. And this is why we are here today discussing how health and food should not be used as a weapon of war. So we know that global hunger and food security, for example, the world produces enough food to feed everyone, yet millions of people, children, women, elderly still go hungry. Can you kind of explore on this? Like, what are the key reasons behind this contradiction?
I mean, it is so sad, Ayaz. I mean, I think one of the things that is, the person who said that was one of the UN Secretary Generals. And he was like, this just shouldn't be the case. And so back in the 2000, when they were trying to come up with a better world, they created some Millennium Development Goals. And there's like, let's do better. Let's end hunger and end poverty. By 2015, we're going to do that. And of course, we reached 2015 and we didn't do that. And then we created new goals, and we created the Sustainable Development Goals, and they gave hunger its own indicators, SDG 2, Sustainable Development Goal 2. And the idea was that we were hopefully going to end hunger by 2030. And to improve the focus, the UN Secretary General, a new one, sort of said, look, let's help the world and let's give them global nutrition targets to give countries that impetus, the political commitment. So between, the decade, they created a decade of action for nutrition, Ayaz. And that decade was supposed to be looking at ending hunger, reducing things like acute malnutrition, chronic malnutrition, increasing obesity in children, anemia, low birth weight, all of these things. And really sadly, we haven't really made the progress on any of those indicators, except for, unusually, reducing or halting the prevalence of childhood obesity. And I would love to say that we did that through actually reducing childhood obesity, but we've done it because we've increased hunger. And that's a sad thing. And if you're asking why, well, I think one of the things, it's a political commitment. It's about a political willingness. And as we're talking today about food and, health services being used as weapons of war, Dr. Alex Duval wrote a book on this about starvation. And in his last chapter, he wrote that it should be something that we hold countries accountable for, that if they have enough food, countries like Ethiopia produce food, but they are living in famine. Afghanistan has, lots of productive fields still, but they still have 50% of the population now going towards hunger. Yeah. There's like sort of 8 countries right now, Ayaz, that is responsible for the growing hunger. And that is 8 of those countries, 60% of the hunger is in these 8 countries that are undergoing conflict, like Congo, Sudan, Somalia, Bangladesh. Now, some countries are making progress and other countries aren't. Sorry, I got to take Bangladesh out of that because it's not in conflict just now. it's Afghanistan, obviously Gaza just now, Somalia, Yemen, Syria, and Congo. And these places have had, conflict a long time. And I think, again, this conflict is often political in nature. But I think we need to go back further than the politics. It's political in nature because years ago, when the world was being divided up, or when we were looking at systems and building this globalized world that we have, the countries that had more income went out to other countries and used the resources, because many of these countries in conflict also have resources. They have oil, they have diamonds, and so they're countries of interest. So the countries that have money want some of those natural resources. So you would kind of say it's pervasive, but it's also one of those oxymoron kind of things, that those conflicts are almost helping the countries that want those resources. And so political commitment, I think, is one of the first things. The second thing is that the voice of poverty is that when people live in poverty, or they don't have access to basic services like health or education, and education, again, Afghanistan's a really good example, Ayaz. For a long time, girls had access to education. We have loads of doctors and lawyers and women from Afghanistan, but now women can't sing. They can't go out and do their jobs because of political decisions. And
Absolutely.
I think these political decisions are something that we do need to, and also the power of the international community. You might know that in 1948, after the war, the world was tired of war. And the world said, let's do better. Let's create the United Nations. Let's create a united system where we stop this kind of war before we get into this intractable situation. But here we are now. We're down a few decades, and we're having war in multiple countries. And the power of the United Nations has been splintered by nationalism. And that was never meant to be. We need to get recommitted to our United Nations again, that things like solidarity and peace. And I think that would be helping us with the resources, because as I said, we do produce enough food. We just don't share it equitably, and we still have 5/8 of the resources of the world being used by the richest, 1%.
Absolutely, Regina. And I think that there are a couple of points that I want to stay here on. One is definitely Afghanistan, for example. Since the Taliban takeover, more than, I think the different reports suggest different figures, but like over 65% of the population do not have enough food, and they go sleep hungry. Especially women and girls don't have access to education or freedom, for example, the basic rights. Just use education as an example. I was there for 2 months, and I saw the state of the country, and I saw the people. People are in despair. They are hopeless. Nobody knows what's happening like tomorrow. Especially before, if we go to 1990s when Taliban were in power, the healthcare access and facilities that people, especially in the remote areas, it would take them approximately 2 to 3 hours in a car to get to a healthcare facility. Whereas in the last 20 years, one of the improvements that did happen was that people could access a healthcare facility within 2 or 5 minutes walking distance. Not talking about the quality of it, but there was some sort of accessibility to the people, and people had kind of future, and they were thinking, okay, there is a hope. Females were into education. We had nurses, we had doctors, but the last 3 years plus, all of that has stopped. And that will have obviously a devastating impact in the long run. And I mean, the impact is already been evidenced now. But you talked about
coming back to that, Ayaz, I think that the one thing you also have to think about is this: it's not just the fact that women don't get to go and be educated. Even those who are educated can't use their services. And in the cultural context of Afghanistan, many people might not know it, but women are not meant to be going and seeking care if it's a male provider. So there is this real dichotomy that you are setting up a system that only allows men to work, but actually the cultural context is that women can't seek healthcare from men. And so it's like, well, what do they do then? Do they stay at home? And we carried out research in Afghanistan many years ago, and we recognized, and we did research on the evidence that if a mother dies, then her infant is 87% more likely to die in Afghanistan. So the idea that we're not protecting children, we started working on trying to bring services, as you said. It's been a really one of the things that we worked with the ministry. We used to work with Save the Children in Afghanistan many years ago, and one of the things that came up from the people was, let's have women and men groups going out to households, so they provide care for mothers, but they're also, the women are not on their own. And this partnerships really worked well. We increased the utilization of health services because we increased breastfeeding rates. And when I say we, I mean the government of Afghanistan did, with some support. They took evidence and they put it into action. So seeing the recycling of going backwards on all of that, they had reduced chronic malnutrition in Afghanistan. They had reduced wasting, which is acute malnutrition. They had begun to make huge changes, despite all of the conflict that had occurred in the early 90s. And so to see that going backwards now, and that families, cannot access healthcare, the services are, that means we are seeing more women dying from preventable deaths. But we know that the children under 2 specifically, if you're hungry, they're more likely to die. And so we're going back to seeing higher rates of acute malnutrition and deaths, which we had stopped seeing for a long time in such numbers in Afghanistan.
And Regina, on that point, for example, I think you highlighted a figure about 50 to 65 earlier as well, the acute food insecurity. These are applicable to people who live in the affected countries, for example, like the likes of Afghanistan or Gaza currently. How exactly does conflict increases food insecurity? And are there any specific examples where, in your experience of working in 56 different countries and leading the policies on nutrition, public health, and as we mentioned in the introduction, any specific examples that you can provide where food or nutrition has been used as a weapon in a war country?
Absolutely. I mean, we could go back, just Gaza's in everyone's minds just now. And, we know that there was all the aid agencies were standing on the corner, on the sidelines. When I say the corner, like literally outside the country, on the borders, with trucks full of food. And yet they couldn't get in because they didn't have the freedom of access. And the Egyptian border, they weren't allowed to cross. So that's one weapon of war. In other words, halting aid getting in. The second thing, and the other thing is, sometimes then we need to look at innovative mechanisms. And so for a long time, we only gave food. But now we know sometimes cash is better. So sometimes now the World Food Program and NGOs like Save the Children and Action Against Hunger, we give cash to them because the private sector are still functioning. They know how to get around these things. And sometimes we need to have those flexible mechanisms. Another example is Ethiopia. Tigray is a really good example. Ethiopia is an amazing country. It had 80 years of conflict in different parts of it. It's on the border of a lot of countries that are insecure. So we've got Somalia, we've got Sudan, we've got both of them have had conflict and poverty going on. So people are running across the borders. And when they do that, they don't run across, they don't leave their own country. Like, people don't usually leave it for a bad reason. They leave it because they're running away from conflict or insecurity. And then they are in the new country. If they're giving resources, then they're setting up conflict in that country because they're saying, well, they're getting our limited resources. Another country, which is a really good example, is Bangladesh, down at the border when the Myanmar refugees came across. They went across from Myanmar to Bangladesh, a very poor country, in the poorest part of it, if we're looking at Cox's Bazar. And those refugees were standing in this place in Cox's Bazar on a hill that didn't have water, didn't have sanitation. So the conflict, by causing people to run across the border, those borders are not set up sometimes to care for them. Your own country, in a case, maybe I'm not sure if you were born yet, but in the original, back a number of decades ago, the first conflict in Taliban, early days ago, we all set up on the Peshawar and the border, and thinking that Afghans were going to come across, but they didn't come across. They stayed in Afghanistan. People don't want, so we had all these resources across the border, but everyone doesn't want to leave. So there's all these things that we have to consider. So one of them is the fact that halting aid. The other one is about security, people feeling secure enough to go out. There's other things that are practices that we used for the safety we have. And again, that happened to us in Afghanistan was sometimes the distances you have to bring food, where the ports are to where the food and the conflict is a distance. And so if the conflict or the insurgents can actually then attack the aid convoys, then we lose our aid people who are running the trucks. And then they see the people that are running the conflict need food as well. So they target those aid convoys and they take the food. And so those are things that we're putting our own people or the people that are doing their humanitarian work are being targeted. So we don't have enough support for the humanitarian workers either, Ayaz. The other thing that happens, and we saw this with Ukraine. So again, we're seeing this really strong network. Who knew? I mean, even I did with all my experience in this field, that 40% of the grain that we have that go to food aid globally come from Ukraine. So having Ukraine go into war meant that 40% of food was stuck in the borders, it wasn't allowed to get out by Russia from Ukraine. So that meant that we had less stocks. So then we have to choose which country gets it. How do you choose it? Do you choose the country you like, the country, and the way people choose it? And, it's choosing by death. In other words, when people start dying, and this is something that Afghanistan, Syria, Yemen all suffered from, because up until then, until the conflicts surged, they were heading towards more middle-income countries where maybe obesity was getting to be more risk than hunger. And so it took longer for them to begin to die. And so that window of period of opportunity, which we could have halted hunger deaths, we didn't act yet because our definition of emergency is by the number of deaths that people are dying. And so to get aid means we have to have death. And so there's these very difficult contexts that we need to have this situation. One, we're trying to get peace faster. Two, that when we define support, it has to become before we have those deaths. Things like severe acute malnutrition, right? We know we can measure moderate, but we don't treat moderate acute malnutrition. But we know if we're having a situation like Afghanistan, Ethiopia, all the countries we talked about, if we could identify, and we do identify moderate, we don't treat them to their severe. But by then, 27% of them will die. Only 20% of them will be even identified, and not even all of them will be treated. So these are some of the challenges, that the system is weak. We don't identify them fast enough, and we don't go in fast enough because we're not given the support as humanitarian actors. Sorry.
I agree. And Regina, you talked about the Ukraine and the 40% of the grain, production for the entire world. If we, for example, as we are talking about the conflict zones and how impacted that has been, if Ukraine or the likes of them produce 40% of the grain, or other countries, for example, produces something else for the world, and something of unfortunate that has happened to the Ukraine, again, in my view, that the conflicted and the less developed countries will be affected further, because the big boys, or for example, the rich or the developed countries, they want to kind of store more for themselves, because they know, okay, now there's a war, and we're going to need this maybe potentially in the future. So there is not equally distributed across everyone, saying, okay, you have your share, I have. It's more about the equity.
I think equity is a huge issue. And look at sort of even some places like China, they have a large population and they experienced the 1930s famine. So what they did was they created a green revolution, which they kind of brought in producing lots of grain for their population, rice, and so that wouldn't have famine again. But in doing so, they use genetically modified crops that need a lot of water. Now they're going through this blue revolution now, which is they're struggling for water. And so they have to decide, and also the grain is not nutritious. So for us as nutritionists, as you know, it's not just food. We want nutrition, because if they have just got calories, they might live, but then they're not having nutrients that they need to grow. And so therefore, if they don't have the nutrients, they're more likely to get sick. And it's this really critical hunger cycle between hunger, lack of essential nutrients, and then getting sick. And if your health systems are not working, because the other thing we didn't mention is that during conflict, and this is a very insidious practice, which we've just seen happening with Hamas and others, is that they choose health centers, and we've seen this in places like Liberia, Sierra Leone, other countries that went through conflict, is that in Mozambique, that they use the health centers, because health centers usually have infrastructure. They're strong places. They're usually set up with water and things like this, or at least access to these things. And so often the insurgents come and take over these centers, or hide in them, so that if you do target them, or, they're basically got a shield, you can't hit a school or a health center. But then, of course, people do hit them to try and get the insurgents. And so they actually are taking out the health centers. And so it's the thing that the health centers are needed, but now they're being bombed. And so we're actually reducing the infrastructure. I sent you some slides when I sent you the pictures of Tigray, where the clinics, all of the clinics infrastructure has been, bombed. If you looked at the same in Gaza,
Absolutely,
how many
that was
doctors and health workers have been bombed?
Yeah, that was like one of my questions. Like, for example, the health systems in conflict zones, in particular the region like Gaza that we're currently seeing, and the Tigray and Afghanistan, the health system have suffered due to war. And so therefore, I wanted to ask if you could kind of describe the impact of war on the health infrastructure and
Absolutely.
how it directly affects nutrition and especially the child health, because that's where like most of the mothers are going to be, especially those who are due to, for the babies, safety and stuff. So how do you think that war
So for your
directly
health
impacts the
system
health
to function,
infrastructure?
Ayaz, you need 6 things, okay? You need staff, okay? So that's one of our, and we see this even in the UK, okay? We don't have enough health workers, but we still have 7 health workers per 1,000 population in the UK, right? But globally, the average we should have about 4.5 per 1,000. Now, Afghanistan used to have plenty of health workers. But again, as we said, some of them are men, and that also doesn't always help because we have cultural context of safety to get them. So even where are they placed, if they're if they're at the health center, women can't always go there. But in other contexts, it might be the fact that if go into the health center, when they go there, there's no health worker. If we're talking about Africa, especially West Africa, there's only 0.1 health workers per 1,000 population. So there's not enough health workers. And if someone makes the journey to go there, maybe they have to take a day to get there. They bring a sick child and there's no health worker. Or when they go, they have to bring money. And if you have to bring money, they don't have money because they're not working. They're not, the work, usually war leads to reductions in employment. And so this is another problem. So a lot of those health workers, they wait for a while, but then they go. They leave for security. They leave to get a better life for their family. So we have a brain drain. Like you're here, other countries, it's not just here, Zimbabwe, Somalia, Sudan, we have them all across the world, Mozambican, very qualified health workers. Because in their own country, there's not safety or there's not progress. They're not able to make that progress. And I remember one doctor in Liberia during the Liberian Wars, after 10 years of conflict in Liberia, and he was one of the last doctors left, a lovely man. And he said, Regina, I'm going to take a job from UNICEF because right now I get people coming to me, but I don't have kerosene to run the generator, so I can't do cesarean sections. I have no drugs because the system I have no deliveries from my drugs. So people are coming to me and I'm helpless because I can't treat them. So I'm frustrated. I'm not doing any good here. I can do good somewhere else. And so it was a very honest thing. So that's one thing, the brain drain. The second thing is financing. Because if you are trying to finance a health system in many of these countries we're talking about, you need to be investing around, in Africa have promised to give 10-15%. They promised to give 15%. Most countries are giving less than 10%. UK gives about 8%. So you need to be investing in your health system. But if you're doing a war, you're spending more on defense. So that's one thing. How are we spending money on our products? The other thing, other than financing, is the service delivery. And again, this is something we spend a lot more money in doing research on. Things like new research, new investigations, new complicated procedures, but simple things like you talked about, child health, immunizations. If we are breaking down immunization systems, so you saw recently that we are seeing the resurgence of polio, we're seeing the resurgence of measles. These common things that we have begun to reduce or eradicate. When I started my work 40-something years ago, it was about 900,000 children every year died of measles. And after 2003, we had a huge global immunization campaign that reduced it down to 300,000. We're going up again because now routine immunizations have been eradicated or halted, especially in these areas. If we wanted to talk about leadership, that's another thing we need for health services.
It is. I
Okay.
think I've
Now,
got questions somewhere down the line there.
Exactly. Leadership is something that we need the leadership, and health ministers they're not often, in fact, in Angola after the war, the peace process in Angola, part of the peace process was that the the population, the soldiers that lost got to be the Minister of Health. So health ministers are not always the most valued positions. It's
Yes.
often thought to be a very intensive drain on resources. It's not often seen as something that is bringing a value, even though we know that to be healthy, we need to invest in our health systems. And only 3% of global research focuses on health system delivery or health system research. In other words, taking the things we already know, the treatments we already have, and investing on how do we actually deliver these in a systematic way, because health systems are not sexy. A new research, a new something, a new drug, everyone loves it. But as we saw with COVID, just like you said, India was producing lots of these new vaccines. Now, and so was France and other countries. And the UK had pre-bought our vaccines, so we had the money to do so. But what about the countries that don't have that money?
Yeah.
So this is another thing about equity. Who has the capacity to pre-buy or to invest in these things about equity, even though we might now produce them in other countries, which again seems like, so India during COVID says, well, we're keeping some of these vaccines here because we need to use these for our own population because India was devastated during COVID. So I think all of these things, and if you're complementing that with the issue you said about how does this affect health? How does this health system destruction? Well, we know that if a child is undernourished, they don't die of being undernourished. They die of pneumonia, or they die of dehydration, or they die of an infection like diarrhea. So simple things kill malnourished children. Up to 50% of the preventable deaths are due to malnourishment. And that means that the child is not nourished effectively. So if we don't have a health system, then we can't prevent those deaths effectively. Sorry, you were going to say?
Absolutely. No, thank you, Regina. That's very insightful. And the use of food as a weapon in conflict zone. I want to come back to that. As we mentioned, food is often used as a weapon in conflict zone. Can we explore some recent examples where this tactic has been employed? Especially, I think it has happened in Gaza quite recently, from what I remember. But then the international community's response was not as strong as it should have been. And we talked about leadership a little bit here. What do you think the international community should have or could have done to respond differently to that, particularly that
This is
tactic
a
of
difficult
Israel
thing.
using, in
The
Gaza?
international community funds the aid agencies. So
Yeah.
that's one thing. So they were doing it. The difficulty thing is, of course, in that response issue, because it was a conflict that should have been, this thing happened, it's like, if we talk about Ukraine is a good example, because 14 years ago, Russia took the first bit of Ukraine and no one did anything. It just allowed to happen. And so all the pleas, it took another until it was a huge, much more impact on the world's food, on the world's carbon dioxide. When we were affected, then we took action. And this is the problem, is that we don't often take action fast enough. Haiti is another good example. It wasn't actually a war, but it was the fact that Haiti was one of these donor orphans. It wasn't given enough support or leadership funding before, and then it had a natural disaster, an earthquake, and then everybody wanted to help, but by then the systems, and then everyone runs in, and there was no leadership because too many people in humanitarian, WHO is meant to be the leader, but too many people were going and trying to be their own solutions. And we've seen this in Afghanistan and Sudan. So this is another issue, is that during conflict, if we do not have leadership about even what to manage this diaspora, people who want to do good, but actually want to go and do it themselves. And that we see this in Ukraine as well, where people driving across Europe to bring nappies, or I'm not saying these things were not appreciated, but we do need to coordinate. We have a very strong humanitarian system. I've been part of it for literally, as you said, about 30 years now, where we've come better. So we have had increasing amount of conflicts and natural disasters, but we have losing less lives because we as a humanitarian sector are beginning to manage it. The leadership thing, and I suppose what you're asking about, should they have said more about to Israel not to do something, or to Russia? How do you stop a country like Russia when they have enough of their own resources? They have billionaires themselves. So one of the things they did was lock down billionaire resources that were in their own country. But even that we could have done faster. But then we look at other companies like Coca-Cola or others, and people make a lot of money from these countries. So they don't make the leadership. There is this, it's always about this economic issues about what do we lose if we get in. Even COVID is a good example, even though it's not a conflict. We didn't lock down flights fast enough because we thought it would harm economic growth. And I think this is something with conflict as well, is this idea about where is the voice of leadership in the sense, and I have to say, and so this is, we might disagree a little bit, is that WHO, Tedros from Ethiopia himself, he took a very strong stance, and he said that there should be peace. He said that we should halt the war, that we need to be prioritizing health systems, that health systems and food should not be used as weapon war. So he spoke out very clearly. Antares Guterres, the UN Secretary General, he has been vocal, absolutely vocal on this. So the two global leaders, our international leaders who are doing their jobs, were not supported by national countries who have more power. And this is the problem that's coming, is that countries with power, okay, and we're entering in a few weeks' time, we could be entering a very, very difficult situation, where another person comes back. Who would have believed that in this world that we built you and I weren't alive in the 1940s when they created the United Nations, but if anybody wants to see the Constitution of the World Health Organization, it's an amazing constitution where we promise everybody has the right to food, everybody has the right to health, and we wanted everyone to have that by 2000. It was an amazing constitution. And actually, the WHO is still the only global organization with every 193 countries have a voice. And even in the UN recently, I don't know if you saw, but when Palestine came into the United Nations and they were given access as a seat, everyone stood up and clapped for them coming in to get a voice in that United Nations. So these UN agencies, they do make mistakes, but they are basically us. You can't blame them for something because they are the voice of the nations, and they only have as much power as we give them. And if the United States, and let's call it out for what it is, the United States has a new president, and if they have that new president, which is someone who doesn't support democracy, they previously wanted us to come out of United Nations, then that could be very detrimental. We have two other countries. We've got Russia, we've got China. Are they standing up? So these global leaderships, when people have enough national power, national resources, and they don't prioritize global leadership. And I guess for me, coming down to it, in 2010, the United Nations set up the Women and Children's Strategy for Global Health, which I was part of drafting. Indicator 7 was that every country should put together a system for the voices of the people to be heard in health system determination. If we listen to the voices of people more, and that means our leaders, our politicians, our academics, if we listen to more what people want and what they need, then I think we could have, maybe our nations would have more power. But at the moment, it's still very much the people who have the money have much more priority, and their voices are listened to much more than any of the people that are from the poor countries. As I said, millions of people right now going to bed hungry, about 900 million every year, of that 900 million, 280 million of them are living in conflict countries.
And that's a very unfortunate thing, or unfortunate numbers to know, especially for someone who has worked in that field or is currently working in that field. And I mean, it's very unfortunate. And I do think, in terms of the world leadership, there could have been done more in Ukraine, in Gaza, in other parts of the world. For example, you talked about Gaza, and in particular, the Russia, and how much billionaires they have and how much resources they have. But equally, if we look at the Gaza, for example, they don't have that. And then the sanctions that came across the world and Russia, that didn't come against Israel when they stopped food, for example, and the other aid agencies to go in at that time. Whether that was, for example, for the people, for their safety to go in because there was a complete direct attack from each side and whatnot. But obviously, that's a more of political kind of a domain to look into. But I think, and I think you will agree, no matter what the situation or the circumstances are in a conflicted area, when there is a need for food, it should be allowed to be delivered, because we don't want the innocent people to die. But also, Regina, did you want to add anything on that?
Well, I just wanted to say, so the other thing is, so I guess what you're alluding to a little bit, which I would agree with, is that some countries spend finite resources on weapons or selling of weapons. So countries like the UK and others continue to send weapons, although we say it's okay to send it to Ukraine to send weapons, but it's not okay. And then we still send it to Israel. I think weapons is one of those scary things. I think I'd rather send food rather than weapons. I have a problem with that. The other thing is about how we deliver food aid. So in Afghanistan and in Sudan, I think you'll have known some of the examples that we had is that because of the insecurity, we sometimes have to throw food off planes.
Yeah.
But then we also throw cluster bombs. And so for many years, we threw food off the planes. That's what your World Food Program did, because they couldn't land because of the mountains in Afghanistan or the security on the ground in Somalia. But so people got used to seeing food drop and they would run towards it. And then we started seeing that the military would use those similar planes to throw cluster bombs. And so people started running towards the cluster bombs. So as a humanitarian sector, we're very careful about all of these. But so I think we have to be careful about what we can do when there is an unsafe situation, because we have to be careful. We have to take care of the staff, not losing staff. We have a finite number of humanitarian actors. In fact, I struggle sometimes to get enough people to go into some of these sectors. I mean, and we had, as you know, in Afghanistan, many of our female health workers from NGOs were told they couldn't remain. We had to do negotiations with that. But then also it's our local staff that are often targeted. So people who work for humanitarian agencies or immunization specialists, they are actually killed because they are on the ground. And so we need that kind of leadership as well. So it's not just about stopping the guns, which are absolutely, but we also need to get a much more strong global solidarity about protecting healthcare workers, protecting humanitarian actors, and making sure that we don't blur the lines of humanitarian, what is the commitment. And so coming back to Alex de Val's book and his final chapter, he said it should be an international crime if people use food or health services as weapons of war. And I would think that is something, I'm not saying it's going to make it happen, Ayaz, but I think at least recognizing that it is something that should be illegal. That right now, and I think until we have those laws, as I said, there's a lot of laws we do not keep. The law of the humanitarian charter, gender equity, right to food, right to health is not maintained and they're not implemented. They're not ratified even if they're signed. However, having it as a law means we can have report cards. We can say who is doing it and who is not. And we should have something about trade. I'm a big believer in, I have a problem with sanctions, as I have to say, because the sanctions in general, the rich people in the countries or the soldiers, they're always protected. It's the ones that, the poorest people, that the sanctions hurt the most. In Zimbabwe during the conflict, it was horrendous seeing the price of bread shoot up to, it couldn't be afforded. The money became a ridiculous commodity in Zimbabwe because the rate of inflation increased so much. And so I guess for me, the other thing is coming back to what we also need to do, besides the global leadership, is also trying to get the distance between our farms and our forks reduced. We live in a global world, but we need to make 4 things, and this is what my research and to disrupt the power, we need to increase equity. So we need to make sure that in all countries, especially the low-income countries and countries where conflict is an issue, healthcare should be free at the point of access. So the cost of healthcare should not be. And we should pay for that by maybe taxing flights or taxing the richest 1 billion billionaires because they have too much. They're flying to moon, to Mars, but maybe 1% of their money could be going. And it's going back to an old idea, which is Robin Hood taxes. And we did use it for HIV, some countries, but I think we should do that. But equity is definitely something, and it should be free at the point of access, no hands barred. The second thing around equity is also about voice, and we need to have the voices of people heard without putting them in danger, Ayaz. Sometimes by listening to people's voices, putting people out there, whether it's a minister of health or whether it's the people from a conflict situation, by speaking up, they could be targeted and killed. So we need to have a voice through our United Nations. So we have to strengthen our United Nations system, but the voice also has to come from the people, and we need a system in every single country that is paid for. And this is us as researchers, as academics, Ayaz. We, as academics, have to stop just focusing on surveys and randomized control trials. We need to be investing in systems for voice to be collected and safely shared. Just like you're doing now. You're sharing voices of people like I did. We have a community conversations. We need to do it in a way that's sharing those voices, and those voices are respected and heard, that they're not thought of. And we need to get rid of words like attitudes or behaviors and move to perceptions and practices, and just try to work carefully about how we talk to each other and how we judge each other.
The RCT or behavior changes, that's a research, those who are interested in, it's a valuable research, but as you said, these kind of issues, bringing the lived experience of the ministers or the people who've been through that conflicted zones, for example, and now they're in a bit of a safety. So we should be bringing that voice into the existence, and so the broader community can understand and know about it, because I think that's a very important point.
And
Yes.
also, because we talked about Ukraine, 40%.
Mhm.
It's great that
Mm.
they have 40%, but what about having food system solutions closer to the people? So, as you
Yeah.
know, Dr. Ehab and I, we've been working with some of our PhD students in places like DRC and Nigeria and Ethiopia to look at what products are locally available that grow naturally, the baobab tree, the moringa. Can we use those things more easily? A teff in Ethiopia that's rich in iron. Is there something we could make locally produced products? More innovation on that kind of situation. There was one country, Malawi, that had their own RUTF, which is ready to use formula for acute malnutrition. But because of cost, because of many things, when they were trying to keep the quality, WHO closed it down because they had too much microbes. Rather than fix the problem, we
Yeah.
need to have these solutions closer. They need to be locally available products, local solutions. Because with local solutions, we do local investment, IS. We need to stop in having one country responsible for, right now, the RUTF is produced in France. It costs $2. It's very expensive treatment. It works, but we need something local. And I think these
Absolutely.
local solutions we could be part of, having that kind of programs that we could go and have research support for that. And I think that is also another gap. Sorry, as you were saying.
No, definitely no. That's a very good point, and I agree with that. That local solutions and also the impact of the war, which we talked about, and the food and the hunger. What do you think are the economic impact of war on health, in particularly, for example, when you look at the broader economic cost of war on health system? How can that local solutions, for example, countries like Afghanistan, like Gaza, for example, Ukraine now that's been almost demolished, how can those countries recover from such a devastating losses?
Yeah, I mean, it takes years, Ayaz. And this is the thing is probably, and again, if you're taking countries, I think a very good example is Sierra Leone and Liberia, West
Mm.
Africa, when they went through 10 years of conflict. And every time they started to make gains, because of poverty, because of lack of investment, because in emergencies, you get investment for 1 year or 6 months. And we started to, with previous government, the UK previous government, started to look at like 10-year investment programs. And we had that same in Afghanistan. And when we had long-term investment onto basic services or essential services like health and education, then we started to see solutions, especially when they were using local people. And so it was a twin track process of building a new communities, building up the services, continuing the services with the people who have delivered them while building the new country. That twin track. So not going and just building a new country without having the services. So one is keeping the services going. The second thing that we found is that investing in health and nutrition and water and sanitation, those sort of 4 sectors, but also investing in peace. So having
Mm.
people sit in dialogue. It sounds easy to say, go and talk, but how do we do it safely, Ayaz? It's often very difficult. Somebody to go and talk, and I come from Ireland, as you know, and my family are from Belfast, and it's still a difficult situation. And the
Yeah.
Brexit saw how difficult that tenuous peace can be. Is that when you start not listening to people, when you start building up those. So what we did get peace, we did start listening, and we still achieved it. And I think, again, President Biden actually is in Germany right now, and he's talking there. And Germany has experience of, back in World War II, it was
Yeah.
the instigator for conflict, and then it had its Berlin Wall in 1989 taken down, where the country was divided, but it's living in peace now.
Yeah.
However, there is also a tenuousness there because there is
Mhm.
a small group of people that are looking at right-wing nationalism. And so I have to be careful. We have to keep culture. I'm a very strong believer. I love my Irish culture. I love my Irish music and Irish food and Irish values of family and fun. However, I think that nationalism, sometimes when it's divisive or when it's looking at new populations, like we're talking about during recent elections, when we talked about people like immigrants or refugees having a voice, if we start to see immigrants or refugees, which I'm an immigrant, you're an immigrant, we're all immigrants. We've moved from our country where we're born to another country, for lots of reasons, and they can build a better future. And so it's about, how do we go back to that reality? How do we get back to where we're valuing the individual nature of people rather than seeing everybody as evil or bad, because they're different? And so I think that only comes about by these community conversations, Ayaz, getting to see more stories valuing. So I think one thing we just saw was the Olympics, where many Olympians for the UK and Ireland actually come from some of our immigrant populations, our refugee populations, and saying, look at the value they're bringing to us as a culture, a country. And why can't we see that in our health system in the UK? 40% of our healthcare work is from external work. So how do we value that? Maybe we should be investing back some of that money back into peace situations, to strengthen, to rebuild communities, long-term commitments, Ayaz. That's what it needs. And not seeing people who are fleeing as evil, but seeing them as looking for a safe solution. So we need safe ways of people to leave conflict areas and then to rebring them, reintroduce them to go home. I'm sure many people who have left want to go home.
Yeah, I would definitely. I mean, I know a lot of people who were evacuated in 2021 when the Afghan government has collapsed and Taliban took over. I know, as you know, I work a lot with the community and my research and so on. So most people say we just want to go back, because they had a good life there and they were living there, but they left because it was danger to their lives, their families, and there was no future for them. That's why they left. And people risked their lives. As you know, you may have heard the recent event that took place in Iran, killing 260 Afghans 2 days ago on the border as they're crossing over to go to a safety. As I said earlier, like I was in Afghanistan for 2 months this year, and I saw that there is no hope and no future for the people, especially for the youth and mainly for the females. And when they're trying to get out of the country, so they have problem staying in the country, and then as they're leaving, they get killed, and they get tortured, and so on. 260 Afghans just being slashed to death by Iranian authority. I mean, still some of the investigation is ongoing. That's inhumane, and that shouldn't be happening. So,
and it's happening in Somalia, in Sudan, in Tigray, in Ethiopia now. There's deaths every day, and these deaths, sometimes the world gets tired of those conflict. It's what we call complex conflict situations. But I think that, like what you're doing with your podcast, what I'm doing, working with communities, we need more of those opportunities. I am very delighted. I don't know if you saw recently, I think I told you that the University of Westminster has just set up a new scholarship for refugees. Edinburgh took, I don't know if you heard that there was a whole bunch of Afghani women that didn't finish their medical degree because when the Taliban took over, Edinburgh has taken, I think, 150 women over there to finish their degrees, the medical degrees now. So there are some places, some universities, some countries and some areas that are doing. Scotland has done a lot around that. Scotland has said, you're welcome here. Ireland has said that, you're welcome. I'm very proud of that. I'm proud that Ireland said it. We have, as you know, Ireland, there's probably more refugees and more people that have left Ireland that probably live in there still. It's funny that we have the same population because so many of us had to leave for many reasons. Long ago, many of our forefathers left because of famine in Ireland, because of back to political situations. The UK, took the food from Ireland that we produced, and it led to famine, and then we had conflict in the north. And so we are a country that has experienced it. It's a tiny little country. But the one thing I am proud of is that Ireland is standing up for it. It stood up for the rights of both Afghanistan, for a small country using its voice within the European Union. It's used its voice. And again, as I said, I do think that, many years I worked with Tedros, who's the head of WHO now. In Ethiopia, I'm not sure we agreed on everything, like paying for healthcare, because I wanted it to be free there. I'm not sure he agreed with me. But now, as the head of WHO, he is standing up for the rights and the fact of trying to get peace and invest in peace and invest in equity. And I think the one thing that you mentioned there, which before I know you were going to, but I think employment is recognizing that need to have, if we are having people, because employment is essential, as you said, to see these people coming across the borders, there is always work to be done. There's so much
Yeah.
work to be done. And so there is always something to be done rather than putting them into jails or into houses until we can sort out, get people working, give them jobs, and then they can buy their own or rent their own houses, build their own houses.
Oh,
And I
yeah,
think that
absolutely.
that is the kind of thing that we need, that kind of seeing ourselves as a post-war of the 1940s, rebuilding rather than this divisive nationalistic approach. I think that would bring more posterity to the world.
Would it definitely would, and I like to use an example of my brother when he came to the UK in early 2000. He fled the country. He came here. He was a tailor. He started opening his own business. Later, opened a textile business as well. Has brought me, my younger brother, alongside his family through the legal route. And then when we came in here, so we studied. Uh, I got PhD, so I work at university as a senior lecturer now. My younger brother works for the DWP. My niece is a school teacher. My nephew is a software development engineer. So my other nieces and nephews are going to schools and colleges and universities. So we have both, and now we are serving and giving back to the community. And that's because of the opportunity that we have had. Now, similarly, other people who are fleeing the country for different reasons, they could also utilize the opportunities and the resources here to build their lives. And the contrary, if I
Absolutely.
use another example, like in Afghanistan, my younger sister, she had one semester left to become a medical doctor when Taliban took over, and my sister-in-law, she had 2 semesters left to become a medical doctor, and my niece, she was, I think she would have completed her degree now to become a teacher from Nangarhar University, one of the prominent university in Afghanistan. So they are now all sitting at home doing nothing, and they're crying every time I speak to them. They
Contact
tell me,
Edinburgh,
I,
see if they can
yeah,
get out of that program.
that would be nice. I'll definitely have a look into it. So let me come back to the solution for improving health and nutrition in conflict zones, Regina. Given the complexity of providing the aid, as we discussed, especially in the conflict affected areas, what do you think are some of the practical strategies that have been effective in ensuring access to food and healthcare?
So what we found, as I said, if we're looking at places, a good example I think is Liberia, where years ago when Sierra Leone and Liberia both came out of conflict at the same time, Sierra Leone focused on building their own health systems and their policies, but they let the services go. They didn't invest in them at the same time. Whereas Liberia, the Minister of Health had been a surgeon, and Dr. Gwenangali recognized the value of the health system support that they were getting from NGOs. So they had one NGO per district to support the strengthening of the systems. And they also made sure healthcare was free at the point of access, so that people would seek healthcare. They invested in a decentralized approach where the people's voices were listened to, as well as addressing water and sanitation and education. And I think that decentralized approach comes back to the principles of Alma Ata, which, if you don't remember, it's the first global health policy in 1978. It was agreed. And the 4 paradigms of that was equity, voice or participation, and leadership or governance. But the fourth aspect was this multi-sectoral approach. So it's not just investing in health, not just investing in education, but recognizing that it takes water, sanitation, and infrastructure like jobs. And so those sort of looking at a social determinants approach, or a health and all policies approach. And for us as nutritionists, we would want nutrition to have a key point in that. So rather than just looking at food for calories, we need to look at nutrients. So we need to be careful that some of the solutions we're bringing in, for example, looking at high calorie biscuits, that's maybe fine in an emergency situation for a short time. But now in India, we're seeing relationships with companies that are putting out these high calorie biscuits with a company, but that's not appropriate because that is not needed in that situation. So I guess for me, it's the contextual solutions that we need to look at each context and say, how do we get here? So you have to involve the local people for that. and work with people, because even if there's a conflict, all the district people stay the same. So keep your district people, ensure we have systems of supporting that voice into action, that we look at an intersectoral approach, that we look at what's working before the conflict comes. Ayaz. And so the countries, and I think this was a really interesting, I don't know if you had a chance to look at my PhD, but one of the things that some of the countries, there's four or five countries that before the Alma Ata was created, they looked at low-income countries having good healthcare at low income. Places like Cuba, places like Guyana, places like Sri Lanka, all of them have suffered conflict. But Guyana even got rid of its defense force, its soldiers, and used its money for food. Cuba gave everybody free food as well as that. Brazil put money into free school meals and trying to support food and education, food service and health. So it's looking at how do we actually get back, because now in nutrition, we have and we just saw it recently, actually, that's happening now. A lot of the new solutions that are coming in, they're all being funded by big industry like Unilever and Kellogg's, this corporate takeover. And so they're looking at promoting their products or easy solutions. There's no easy solution for this. It takes long-term getting back to growing our own food, getting the distance between farm and fork reducing pesticides, reducing antibiotics in our system, maybe reducing meat of the affluent populations because poor populations don't eat it, and trying to make sure we're having nutrient-dense local food solutions available, that even if there was war or conflict or natural disaster, that we would do a change. And then looking at climate change, we haven't mentioned that this time, Ayaz.
Yeah.
Climate change is a huge impact because as we're finding, many of these countries that are affected by conflict are also affected by natural disasters that are becoming worse. 50% of them in Asia. And even though Africa has taken over, Nigeria specifically, as having the most children dying of malnutrition, next to India, it is looking at places where we're having maybe increased floods, where that's taken away the land, the soil, the topsoil. So the nutrients in our food is changing, and how much we're using pesticides or seeds that we don't have ownership of. If farmers can't replant their seeds because it's owned by a company, that is leading to conflict. And so we need to begin to start defusing conflict situations before they escalate to conflict, and trying to solve them in a peaceful way through dialogue. And some of the solutions we are helping or allowing to be put in place will be our future conflicts if we don't stop them.
Absolutely.
Because we give the power to these 5 or 6 transnational companies that really only care about profits. And so for us in nutrition, and even in the UK, we're not in conflict, but 67% of what we eat is ultra processed. And that is because we're allowing these corporate organizations like Kellogg's, like Unilever, like Philip Morris to have voice. Malawi has had 3 famines since we had the GAIN program, Global Alliance to Improve Nutrition, had free trade. And some of the companies that are now invested in taking land in Philip Morris produces tobacco in Malawi and that causes a nutrients of the soil. Tobacco does, and we've actually gotten rid of tobacco elsewhere. We should be planting food there instead of you shouldn't be planting tobacco in a country that's suffering from famine. So these are the kind of thing, but they bought the land cheaply. So I think these are the kind of thing we need to get in peacetime. We need to see the red flags, get good at playing chess, is how I tell my students, Ayaz, is trying to say we need to get as good as some of the corporate sector as seeing what is happening in the future. Don't wait until people start dying or bombs start falling. Get in and start planning solutions. And the only way we can do that is getting around the table and dialoguing, looking at land, looking at resources, and using these solutions that we have, which is our equity, voice, good governance and leadership at all levels of our systems, connecting up our food and health systems more effectively without the voice, the strong voice of corporate, the stronger voice of the people. So maybe displacing the power.
And Regina, thank you for that. Coming to the maternal and child health amidst conflict, we know we touched based upon this, and I just want to pick up your view on this is with the rise of global acute malnutrition and the increased vulnerability of women and children in conflict zones, what specific intervention do you think can improve maternal and child health in these areas?
I mean, I think one of the first things, Ayaz, is that we have to identify undernutrition faster. We need to make sure that right now we know, and it's something that I've known for at least 40 years, is that sometimes cash works better than food. So sometimes giving out cash transfers to mothers, we know that the evidence is clear that not only does it help to feed the family, but the mothers can also help to overcome poverty with it. So Ethiopia has some good progress, but it only goes to 10% of the population. So that's one, looking at innovative solutions, bringing solutions closer to the population. So is there nutrient dense solutions that are available closer? One of the big things, Ayaz, is healthcare workers. We're struggling with 7 per thousand in the UK. But in those countries we're talking about, we're down to less than 1 or 0.1 per thousand. So we need, and the world has talked about, let's do community health workers. And you and I know, because Afghanistan has used them for many years. It was actually research in Afghanistan and Liberia that I did a few decades ago, which really looked at the fact that for a community health worker to be effective, they need about 18 months training. Most community health workers don't get that. But even if they have 18 months training, they need to have a system. They need to have somebody supporting them. They need to have some support. They need to have the availability of their solutions, their drugs, their things that they're going to give them. So they need to be able to identify malnutrition and treat it. Obviously, preventing is also good. We see that with the NHS solutions right now. They're talking about prevention. Since 1978, and then again in 86, this focus on prevention. We've been focusing on treatment too much, Ayaz. But we need to get back to focus on prevention, getting back to routine immunizations. With mothers, we need trained, skilled maternal health people. We need midwives that are there with the mother when they're delivered. Afghanistan, all of Asia, in fact, has got between 40 and 60% of their stunting. They have children who are dying or anemic. And the mothers are not prioritized. We don't feed our mothers effectively. We don't treat our mothers effectively. We're not there at the point of access. Bangladesh has tried to come in by doing increased numbers of cesarean sections, thinking that's the solution, but it's not, because cesarean sections can lead to things like reducing our microbiome, which is our gut. If we do too many of those and they're not needed, that's not healthy for future. So I think we need to get back to safe delivery. That's one. Safe and having at least 4.5 health workers per thousand populations, especially when there's a conflict. Bring in the healthcare closer to the population. Essential services like maternal safe delivery, immunizations for the children, making sure that you're breastfeeding. I haven't even mentioned that. I can't believe I haven't mentioned it yet. But of the 5 million children who still die of preventable deaths every year, Ayaz, and that's good because it used to be 12 million. So we have made huge progress. But there's still 5 million children dying of preventable deaths. 823,000, almost 1/5 of those, could be reduced, stopped by exclusively breastfeeding babies for the first 6 months. Afghanistan was making great progress on this. But the problem is that for a mother to breastfeed her child, it doesn't require telling them. In the UK, 87% of our women start breastfeeding. But by 6 months, only 1% of our mothers are. And then one of the reasons are, if you talk to our mothers, it's because they're not given the support. And also because there's this misperception. There's the global industry of baby milk substitutes. They spend $70 billion every year promoting the use of artificial milk, all right, which has E. coli spores in it. It's because it comes from cow. It's got cow's protein in it. Ehab. Sorry, I keep calling you Ehab. And we don't have anything like that to support breastfeeding. We have very little funds going into breastfeeding. And if we do put money into breastfeeding, it's telling people to do it, not helping them. So we need to get a system of global solidarity to support breastfeeding. That is one of the first things that we can do, as well as having a mother there, or a midwife, or somebody who's been trained in competency on skilled attendance, feeding our mothers. Also, the other thing that we know, Ayaz, is reducing early marriage in girls. You know, we know that an adolescent having a baby is much more likely to have maternal and child deaths. We need to get, we know for every year a girl finishes education, she's more likely to be healthier, but also her community is more likely to seek healthcare when they need it. So like Afghanistan, what you said is that if we get our girls going to school, there is evidence. Having more nurses rather than doctors. Many Asian countries have focused on doctors rather than nurses. So we need more nurses and midwives. And if we're going to have community health workers, they need to be supported and supervised. And they need to be trained in competencies. So those are
Yeah.
things that I think that need to happen.
Those are, I think, very great things, and I hope if it comes into life, it would bring positive results. But as we mentioned at the start, the world is keep producing food, and you said pretty much everything has become so commercialized. Despite so much of it, yet the progress towards achieving the Sustainable Development Goal 2, for example, zero hunger by 2030, looks bleak. So what? This would be my last question, but here on this topic, like, what do you think that the global response to nutritional emergencies and that zero hunger by 2030, and obviously the impact of the conflict that has brought in and the war has brought in, what do you think the response of the international communities, global, have been in
Hunger
achieving the
is
zero hunger?
a political choice. All
Mhm.
right. We should have, I said, we make enough food to feed the world, but some of us have more food than we need, and we have 40% of our food in the high income countries that is wasted. We waste 40% of our food. And so it doesn't mean give food waste to the poor. It means that we need to distribute resources more equitably. So one of them is to have the political choice to put real resources behind this. We need to get local solutions. We need investment in food systems that is nutritious food. We need to be working with farmers more, Ayaz. 50% of farms are produced, the food that is produced by women, but only 3% of resources go to women farmers in relation to aid. So we need to be looking at a genderized approach. We need more resources going to women, both women as health workers and women as farmers. We need to be making sure that the FAO, which is the Food and Agricultural Organization, they involve community organizations. There's a very good organization called FION, which is based in Europe, but it works all across the world, trying to make sure that food and nutrition are brought into food systems. Those of us who work in health and nutrition, we need to link with those systems. And then we need to be looking at climate change and plastics. So all of this thing is, the reason I'm saying all of these is that conflict comes about because basic needs are not met, like
Yeah.
food, like nutrition, like access to health and education. And so we need to, as a global community, support, and we were doing well for a little while. We as a global community were beginning to put, around 2005, we began to make real great strides in reducing global poverty and inequity. And now we've gone the opposite. We've different leaders have come into play where there's been a much more focus on economic growth over social justice. And I think the one thing is, I would want that. Instead of looking at a world of neoliberal principles, I really think that we need as a global community to have a global solidarity agreement that social justice principles of the right to food, the right to education, the right to health services, and the right to jobs, those social determinants that are included in the humanitarian charter, the human rights charter, countries should be held to account. And therefore, whether it's sanctions or trade agreements, we need to be very careful about when we're making trade agreements with countries that are not upholding those humanitarian principles or human rights principles. Because then, if we're allowing them away with it at that stage, then they're
Yeah.
going to feel like Russia, like they think, well, it's okay for me now to go and take over another person's land.
And yeah, and on that note, Regina, I think thank you very much for your time and input for what promises to be an enlightening conversation and this crucial topic and aspects of health, nutrition, conflict, and war. I do hope that we will see the world in a better, uh, peaceful way. And I hope that the figures and the numbers that we talked about, 5 million children are dying, 65% people don't have food, for example, in various countries. I hope that does reduce with time. Thank you, Regina, for your time.
Just before we finish, I was just to
Yeah.
say there's 2 or 3 events coming up. There's across Europe, but across
Mhm.
the UK, there's a right to food and nutrition. We're trying to get cities. So at the moment, Liverpool is a city, Manchester is a city, Belfast is a right to food city. We're trying to get London and Birmingham to be right to food cities. We want the whole of UK. But if we could have this global commitment, but you start in small, start in UK, start in Birmingham. So if you hear of a right to food movement, try and join it. The other one is there's another group. If you're a young person, we need to hear young persons' voices. So there's a Bite Back campaign. Join that if you're a young person. And the third thing is we're doing community conversations. conference in these cities in the next few months. We have in November 25th in London, we are having a film called The Community Conversations, which is looking at voices of people living in food insecurity in UK and Ireland and across the world. So if you're around in London on the 25th of November, do come into London. But if you hear of anyone fighting for the right to food and nutrition, join it. Join the right, because your voice can make a difference, even if you can't go out and work with humanitarian organizations, even if you try and support local entities and start working with local groups. And by electing people that are going to take care about our children and take care of poverty. And yeah, I think that's one thing we could do.
Definitely.
So take
thank
action.
you very much. Yeah, thank you very much. And I think we'll be touch base on that, and I'll be more than delighted to help support in any way possible. But thank you, Regina.
Not at all, Ayaz. Thank you.